Hello, everyone. My name is Melissa Mittelhalser, and I am the Program Coordinator for the Childhood Lead Poisoning Prevention and Healthy Homes Program at the Partnership for Maternal and Child Health of Northern New Jersey. The following presentation is for parents and families with children 0 to 6 years old, or for professionals who service this audience. The Childhood Lead Poisoning Prevention Program aims to educate families on reducing lead exposures, maintain healthy and safe homes, and to provide solutions to and connect families with resources. During this presentation, we will be discussing what lead is, where lead is found, some common sources of lead, its harmful effects on children, what are some folk remedies, and how to reduce lead exposure. So what and where is lead? Lead is a natural metal. It's found in the earth, and it's a substance that you cannot taste, you cannot smell it. It's commonly found in dust and soil, in water through leaded pipes, certain foods, factory packaging, ceramics, home remedies, cosmetics, and most commonly in New Jersey, old paint. In recent years, the media has shined a light on Flint, Michigan for its water crisis, lead burdening its residents with lead-contaminated water. In New Jersey, we have children with higher rates of lead exposure than even Flint, Michigan, with Newark having the highest number of children with elevated blood lead levels in the state. Elevated blood lead levels are defined as greater than or equal to 5 milligrams per deciliter, which is the national lead reference level. As you can see, Newark had a number of 24,831 total children under the age of 6 with a blood level that was higher than 5. The most common source of lead is found in old paint and leaded dust and soil. Most homes that are built before 1978 contain some lead-based paint. It is important to note that remodeling a home or repairing a home or even a windowsill with chipping paint can increase your family's exposure to lead dust if they are present when the repairs are being done. It's a good idea if a mother or children are in the home when a house is being repaired to be away from that home until the repairs are done completely. So what is lead? Lead is a poison. It is toxic and it is harmful when it accumulates in the body. There are two ways that people can be exposed to lead. One, through inhalation, so breathing in lead dust, and two, ingestion, eating lead or lead dust from hand-to-mouth activities. Babies or young toddlers are high risk for exposure because of their hand-to-mouth behavior. They constantly put things in their mouth, they're exploring their worlds, and even with paint chips around a windowsill, they're easier to access that and eat it. Now let's discuss what happens in the body when lead enters. So it blocks the key steps in blood production, causing anemia, which is a red blood cell deficiency. It also blocks iron absorption and competes with calcium. Keep this in mind later on when we talk about nutrition. It's very important that children and adults get enough calcium, vitamin C, and iron in their body. Lead poisoning can be most harmful to children, especially children under the age of 6 years old. Their brains are still developing, they're growing, their nervous system is still developing, they absorb more toxins since they are lower to the ground and they crawl a lot at younger ages. They have weaker immune systems than adults and they detoxify at a slower rate. So the amount of lead that an adult would pass through their body, a child may not be able to pass it through, and it absorbs into their bloodstream and goes to the brain and does its damage. Lead poisoning can be detrimental to a child's health. When a child has an elevated blood lead level, they can experience developmental and cognitive delays, growth problems, speech and hearing problems, anemia, kidney problems, reproductive disorders, elevated blood pressure, and in severe exposure, this can lead to coma, convulsions, and even death. Lead directly interferes with cognitive development. Some of the social effects of lead poisoning in children can be exhibited by reduced IQ, poor school performance, behavior problems, hyperactivity, discipline problems, and even juvenile delinquency. Since lead affects the brain over time, sometimes in children you won't see any symptoms or any signs that it's causing any interruptions in their cognitive development. A lot of times parents don't realize that their child has had lead poisoning until they're older, they're in 3rd grade, and they're having trouble reading, paying attention, and they might even have ADHD, which is attention deficit hyperactivity disorder. That's not to say that every child with lead poisoning gets ADHD, but there is a link between the two. Since by looking at a child you cannot tell if they have lead in their system or not, the most important thing to do is get your child tested for lead. In 1995, New Jersey passed a law, the Universal Childhood Lead Screening Law, that requires all children receive 2 blood lead screenings, one between the ages of 9 and 18 months of age, preferably at 1 year old, and the second being 18 to 29 months of age, preferably at 2. It is recommended that children do get lead tested once every year until they're about 6 years old. Once you take your child to the doctor for a blood lead test, it's important to know what the blood lead level is. Now, there's no safe level of lead in the body. However, any blood level that is greater than 5 does require attention. The doctor or the nurse will ask you to try to identify what the source could be, whether the home is built before 1978 or the child was exposed to a certain food or item that contains high levels of lead, and then try to eliminate that and retest the child to see if the blood level went down. Blood levels of 2 to 3 over time have shown to reduce IQ. Now, it's important to advocate for your child and ask the doctor what the level is, no matter what. If the level is 5 or above, you want to retest the child after a few months or what's recommended by the doctor. Although it is recommended that children get tested for lead at the age of 1, it is possible for a child who was exposed to be tested as early as 6 months. Blood tests can be done by a physician. Most insurance companies will cover the costs. If not, if the child does not have insurance, by law, the local health department can schedule a free lead screening. Depending on the severity of the exposure and how well your child can eliminate lead in their body, your child's blood lead results may vary. So what do the numbers mean? A blood level of 0 to 4, this means that there is very little lead in the child's body, no action is required, and sometimes a doctor won't even let you know what the results are. What you can do is just follow up with blood tests annually until the age of 6, as recommended. If the blood level is between a 5 to 14, as a result of a 5 or higher, this is considered elevated or high. Speak with your doctor about the next steps. The health department will visit your home to locate the source of lead, and your child should be retested within 1 to 3 months. If the blood lead level is between a 14 or 44, your child's lead level is quite high. You and your doctor should act quickly, and the health department will visit your home to locate the source of lead. Your child should be retested in 1 month or sooner, depending on the doctor's orders. If the blood lead level is a 45 or higher, this is extremely high. Your child needs medical treatment right away, and sometimes they will be hospitalized for chelation treatment. At this point, your child cannot go back to the home until the source is identified and removed. Your child should be retested after receiving treatment. Pregnant women who have been either exposed to lead or live in a home that's built before 1978 should also get tested. Lead can harm the baby as it enters through the pregnant woman's bloodstream and passes through the placenta. It can affect the baby's body, organs, brain, and more. The risks associated with lead in an early pregnancy are brain development issues, nervous system issues, and delays within the child's development in the first 2 years of life. Extreme cases can lead to miscarriage or even stillbirth. Other sources of lead include folk and home remedies. These remedies are traditional medicines that are used to treat common ailments. However, they have high levels of lead. Some of them are greta and azarcon, so traditionally used amongst Hispanics, and it's a remedy to treat colic, upset stomach, vomiting, or constipation. These are yellow and orange powders that can contain as much as 90% lead. The following pictures are from the New York City Health Department. They have given us permission to share with the public. These items photographed are from actual lead poisoning cases. So here we have spices from South Asia, red hot spices, chili powder from Bangladesh, and turmeric powder from India. Now, this is not to say that every single batch of turmeric, chili powder, or red hot spices has lead in it. There's been some research that lead can be found in these items, so just to be careful. Spices from Georgia, the country located in Eastern Europe, has also some spices that contain lead, such as yellow flower or uchko sinelli. Even toys can contain lead. We see with the picture on the left the painted maracas. They are from Ecuador, and a 9-month-old child had a blood level of 12 units per deciliter. These maracas were purchased at a street fair and contain 63,000 parts per million of lead. If you notice on the maracas, they're very shiny, they're vibrant, and this is the reason why they use lead in paint, so that the paint could last longer and it could be more vibrant and look shinier. On the picture on the right, we see blocks. Very common, we've seen these many times. And again, it's the paint on the blocks that causes the lead poisoning. A 1-year-old child had a blood lead level of 13 because they were putting this in their mouth. Here are some other examples of lead products. We have amulets and charms that contain lead. In the first picture on the left, a 1-year-old child from Bangladesh had a blood level of 19, and tabiz was used to stop the child from crying. Underneath that, we see another item called shisha. A 4-year-old child had a blood level of 26 units per deciliter. The grandparents sent this from Bangladesh to use for speech therapy. In the picture in the upper right corner, we see tabiz. The penny does not have letters to show the size of the item. A 3-year-old child had a blood level of 17, and this item was obtained from India. Underneath that, we have a charm that a 2-year-old child swallowed and had a blood level of 20 units per deciliter. And this charm was obtained in India as well. Here's an example of an amulet from Cambodia. A 1-year-old child had a blood level of 20 because they were putting it in their mouth. This amulet was worn around the child's neck since the age of 3 months for a blessing. You can see the black pieces with the arrows pointing. Those pieces contain a majority of lead. After the source was identified and taken away, the child's blood level dropped. In this light here are some items that were purchased in New York City: jewelry, bobby pins, charms, and to a child, especially looking at the orange heart, you would say, oh, that's shiny, that's colorful, I want to play with it, I'm going to put it in my mouth. And that's exactly what happens. So just be careful where items are purchased and keep certain items away from children out of reach. The following makeup, Kohl, Kajal, Surma, and Tiro, are commonly used amongst Middle Eastern and African cultures. These products do contain high levels of lead. Now, if you do use these products, there are alternative products with no lead in them, and they're made by popular makeup brands such as L'Oreal, MAC, Wet n Wild. The eyeliners have the same consistency as Kohl or Kajal and the texture, and these items may be found at your local pharmacy. So far we have discussed what lead is, what are the risk factors of lead, what are some sources of lead. Now let's talk about ways that we can reduce lead exposure. In your homes, these are some things that you can do. Run cold water for about 1 minute before using. This is especially important if you may have leaded pipes. Cold water will not leach off lead, but hot water will. You also want to make sure you flush out the water that's been sitting in the pipes overnight. Use a damp cloth when dusting. We know that dust can have lead in it, and in order to trap the dust, you want to use something that's a little bit wet, not dry. Thirdly, use duct tape to remove paint chips. If you see paint chips around a windowsill, which is a common place, or in a closet, and you don't have the means to repair it professionally yet, you can use duct tape over it and rip it off, or just leave the duct tape on so it's not exposed to the child. Professionally repair areas with peeling paint. Make sure that this is done professionally and you don't just do it yourself. Lead-based paint can be difficult to get rid of, and you definitely need a professional to do this. Never sand, scrape, or burn old paint. Never dry sweep. If you are going to dry sweep, follow up with mopping. And leave your shoes at the door. The key to keeping kids lead-free is through prevention. Some of the things that we can do for our kids are make sure that they're eating foods that are high in fiber, iron, calcium, and vitamin C. Make sure children wash their hands before meals and after they play, and before they sleep. Also, wash toys and pacifiers regularly, especially toys that children put in their mouth. You want to wipe them down after they're finished playing with them and before they're playing with them. And as always, make sure children get tested. This is the most important thing because it's the only way to know if a child has lead in their body or not. As I mentioned before, children should be getting tested once every year until they're 6 years old. A well-balanced diet is very important for combating lead. Healthy foods that fight off lead are high in calcium, iron, and vitamin C. Also, children with empty stomachs absorb more lead than children with full stomachs. Some examples of foods high in calcium are milk, yogurt, cheese, tofu, green leafy vegetables like spinach, kale, and broccoli. Foods that are high in iron could be red meat, fish and chicken, dried beans and peas, tofu, raisins, prunes, and iron-fortified cereals. Foods that are high in vitamin C could be oranges, grapefruit, tomatoes, strawberries, broccoli, Brussels sprouts, etc. If you're unsure of whether you or your child may be exposed to lead, here are some risk factor questions to ask yourself. 1. Do you or someone you know live in or regularly visit a house built before 1978 with peeling or chipping paint? Do you or someone you know live in or regularly visit a house built before 1978 with recent, ongoing, or planned renovations? Do you or someone you know live with an adult whose job or hobby involves exposure to lead? Or do you or your child have a blood level above 5 units per deciliter when last tested? If the answer was yes or I don't know to any of these questions, that might indicate a high-risk status. Be sure to check with your doctor or local health department for a blood lead test. Repairing your home with lead can be very costly, and for some that deters people from even testing their home if they have lead. Fortunately, New Jersey has a home lead remediation and reduction assistance programs. There are designated community-based agencies that offer free lead hazard assessments of your home, and if you are eligible, you may qualify to have lead hazards in your home repaired for free of cost. These community-based agencies offer lead remediation programs throughout northern New Jersey. Greater Bergen Community Action Services, Passaic and Bergen County, Department of Health and Services within Bergen County, services only Bergen County, Proceed Inc., services Union County, La Casa de Don Pedro, services Essex County, and Paco, services Hudson County. Here is some context to some other resources that might be helpful to you. For general information, you can check out New Jersey Department of Health. For Bergen County and Hudson County, if you have a lead service line and you would like more information on that, you can check out mysuazwater.com. For poison control hotline, you can reach out to the number 1-800-222-1222. And to check if items may have lead poisoning or there's a recall, you can check out the Consumer Product Safety Commission. Well, this brings us to our last slide. In summary, lead poisoning is a public health issue that can be prevented. Children can be more exposed to lead than adults, and it's very important that children, pregnant women do get tested for lead regularly. If you have any further questions, please feel free to email me. Also, if you're a professional in the public health field or work with families and would like to join our Northern Regional Childhood Lead Poisoning Prevention and Healthy Homes Coalition, please feel free to reach out to me via email at mmittelholzer@partnershipmch.org. Also, be sure to follow us on Facebook, Twitter, Instagram, and check out our website, partnershipmch.org. Thank you.